Okay, so up next, we have Mustafa Syed, who's the Director of Bioinformatics at Southern Research. Mustafa will be sharing how Southern Research uses LabKey as part of their Catalyst project to streamline complex operational workflows across multiple systems. He's going to highlight two really great examples, the provider onboarding workflow and the kitting workflow, and show how LabKey serves as a central hub for their data coordination, validation, and secure collaboration.
Yeah. So um, as she mentioned, like I will be presenting Catalyst project and how we are using LabKey to streamline and improve some of our operational workflows. So I will begin with this quote from Hippocrates. It's far more important to know what person the disease has than what disease a person has, because that reminds us that the individual variations matters. Understanding the unique genetic, social, and environmental context of each person is just as important as identifying the disease itself. So why does the diversity matters in the clinical studies? By focusing our studies on the underrepresented population in the research, we can discover variants that influence health risk and also the outcomes, not just at the individual levels, but also at the level of population, at the population levels. And America, US is a quite diverse country. You can see like so many different colors here representing different racial minorities that are present here in this country. But unfortunately, the uh, diversity is quite underrepresented in most of the clinical research. As you can see here, like the 76% of the population, the 76% of the participants in the clinical trials are the white population. And this lack of diversity in the clinical trials can limit our understanding of the treatment efficacy and also could have like a mask the potential side effects or misinformed treatment decisions. In the same way, like there is lack of diversity in genomic research. Despite like major investments in genomic studies throughout the world, most of the largest scale research still centers around like the population of European origin. 78% of those studies have like participants from European ancestry. And this can again lead to some serious issues. Clinical applications of genomics may be incomplete or even misleading, as many of the genomists know, like different population can carry different mutations for the same disease, and it is complicated to diagnose and treat those genetic diseases. And when it comes to the state of Alabama, the Catalyst is funded for the state of Alabama. Alabama faces several persistent health challenges. The chronic diseases, such as heart disease, often goes undiagnosed until patient reach advanced stages. Hereditary diseases are frequently passed silently through several generations without any early interventions. And as you can see, the Alabama has a major rural population, so the rural healthcare remains a major barrier. Alabama has a significantly higher rural population as compared to other states, so making access to specialized care is quite limited and inconsistent in those areas. And during the time of COVID, uh, Alabama experienced much higher fatality rates than many other states, which is highlighting another reason the health system has vulnerabilities. And the third reason I can mention here is like the state of Alabama has a higher death rate now, which exceeds its birth rate. and it's quite high compared to several other states in the US. So Catalyst was created in response to these challenges, these urgent challenges, and early detection, genetic screening, chronic disease testing will deliver personalized care to the people of this state, and bring like improve long-term outcomes across communities. So what does the participants gets by participating in the Catalyst study? They get genetic insights into risk for developing heart disease, diabetes, and cancer. Those are the most common comorbidities at the time of like COVID. They also receive personalized medication response profiles that tells how patients' genetic affects their medication response, and that will help providers to optimize treatment, reduce any adverse reactions to drugs, and also improve outcomes overall. And they also receive polygenic risk scores for breast cancer and coronary artery disease and several other. So this uh, the for this is by combining genetics, lifestyle, and clinical data, clinical history, and it will predict 5 to 10 years risk of developing those diseases. So, and many other PRS for many other disease streams is also coming soon. So participants receive clinically actionable results. What we mean by this is like they can share these results with their doctors to help guide treatment. So results can go directly to providers if the participant provide their provider information, and every result is clinically actionable, meaning like it can be used in real healthcare settings. So participant can discuss those results not just with the doctor, but also with genetic counselor, and for free of cost. So Catalyst provide genetic counselor free of cost, and they can genetic counselors are available to explain results and support decision making. So beside the individual benefits, participants also contribute to a research database that they can transform, that can be used to transform chronic disease management in the state. So joining Catalyst is simple. You go to this website, Catalyst by Southern Research, set up account, fill registration form, give consent, fill out some short health survey, and then provide sample, either a blood sample through the provider's office, through a doctor's office, or a buccal swab sample, a cheek swab sample, which they can collect at home. They get results in 6 to 8 weeks, and they can review results with their doctor or a genetic counselor. We recently extended this protocol to also have buccal swab, to collect buccal swabs and do the sequencing through buccal swab samples. So you can, a participant can order a cheek swab or buccal swab kit online. They get that kit at home. They can collect samples at home in minutes and then send it back to the in the provided envelope, in the pre-labeled envelope, and the results will be delivered securely. They can meet with genetic counselor after the results are developed. But there are some limitations of like not able to collect blood samples because we cannot do biobanking for any kind of future research. So this is a quite big effort for a small team at Southern Research. So it is only possible thanks to partnerships like vendors like LabKey. So it begins with the participants collecting who are interested in the test and give either blood or buccal swab samples after registering and consenting. Then samples are collected and sequenced at Broad Institute. Data is analyzed by Myome, and report is sent to participants or their doctors. And participants can also share their clinical data from the participant portal, which is managed by another vendor, Vibrant. But the LabKey serves as a data integration hub, coordinating everything and enabling a secure and efficient collaboration. So I want to pause here and highlight the central role LabKey plays in powering Catalyst. First, it is our integration hub, bringing together data from multiple vendors and multiple systems into a unified environment, which is critical for a project of this scale and complexity. Second, LabKey enables workflow automation, whether it's a provider onboarding or a sample processing. Much of the heavy lifting is now handled through scheduled data loads, automated communications, and API-driven actions. Third, the LabKey is used to manage inventory and logistics, particularly tracking kits, providers, participants, all the way from shipment to results delivery. And also, LabKey plays a central role in data validation and quality assurance process. So in short, LabKey is not just a data platform, but it's an operational backbone of Catalyst. So Catalyst is a complex initiative, and that is only made possible through seamless collaboration with multiple vendors that are highlighted here, and when each playing a distinct and essential role. So when the task, even when the tasks are unrelated, every partner contributes to a bigger picture. It begins with Vibrant that supports participants' engagement, Broad Institute where the sequencing happens, and then Myome handles genetic analysis, and LabKey integrates it all and bring the structure and coordination. So together, these contributions create a cohesive and efficient workflow. It's kind of like instruments in the music. Each vendor is like a different instrument in the symphony, and it is not just the variety, it's the harmony. The collaboration is what makes the Catalyst more than a project. It is not just a project, it's a shared effort through all these vendors to transform healthcare in the state of Alabama. Now, you have seen the big picture. Let's dive into two of the operational workflows for which we are using LabKey. The first of which is the provider onboarding, and then later I will continue with the kitting workflow. So our provider onboarding used to look like this. Providers or doctors fill out the interest form, and data is loaded into an Excel file. Then our medical affairs team validated clinics because we need to ship kits to those clinics. So they make phone calls or emails to those clinics and validate the information that is kept is correct, and that is kept in a separate Excel file. Then the verified information is sent to Myome to set up account for those providers. Again, it was managed in another Excel file. And then the activated provider list, once the portals are set up for providers, is shared with the Vibrant, which manages the participant portal, and that is again managed in another Excel file. So you can see like there are a bunch of Excel files here and a lot of manual work. So we got rid of like all those Excel files. We replaced Excel chaos, all that chaos with LabKey, with just one workflow in LabKey with all that clarity. And LabKey brings centralized database, faster processing, and fewer errors because we got rid of a lot of manual entry and automated updates. So here's how like the workflows now operates with the LabKey. Data is automated data loading from the Microsoft Forms every morning that eliminates the need to manually enter data and ensures that our records are up to date. Then the daily status emails goes every morning after each data load, and that informs our internal team how many providers were onboarded and total number of providers and providers that are at different stages. Then LabKey also provides we provide a pre-filled email templates to communicate with providers. So as a part of data verification process, we have an email template that is automatically populated with the provider information and the message content. So the emails are ready to send with just a single click, and that significantly reduces manual effort and ensures consistency in this process. Then the last one is the automated data sharing with vendors. Provider data is shared automatically to support account setup and activation for providers and doctors. And then activated provider list is automatically automatically sent to Vibrant to be displayed on the participant portal. So here are some snapshots from that workflow. There are custom views by workflow stages, and all those different views to just display relevant data fields and at each stage of the workflow and hide any irrelevant data field at that stage. And then charts that shows like all those providers, total count of providers that are at different stages. Then here is the actual list of that providers, and this is all we send our daily onboarding summary, an email alert that goes every morning. So as the workflow matured, we have to refine workflow. The good thing about LabKey is it's not a rigid system, so we can modify the workflows and still have backward compatibility. So initially, when we began, we have this process, a step called in process, which was later split into confirmation by medical affairs and confirmation by data team. And in the same way, like initially we have a stage called activated, which was later split into account setup and account activated. So why we are splitting stages is to have like to improve clarity and accounts and accountability across different teams. Next, let's look at the kitting workflow, which is built using LabKey Sample Manager, and we use it to track inventory, validate data, and document logistics related to kitting workflow. So we started by mapping the full process in the flow chart. The workflow include like kit administration, kit assembly, documentation and tracking, and then communication with providers. But we begin using LabKey to just support the documentation and tracking portion of this process. And next, we built a data dictionary that contains that contains all the data elements and definitions, descriptions of those data elements. We have 4 core entities, as you can see here: provider, patient, sample, and kits. So for each entity, we define data fields that are required to capture, manage information through the various stages of the workflow, what each of those data elements mean, where it comes from, how it is formatted, and how it relates to other data elements. After defining the core data entities, provider, patient, sample, and kit, the next step is configuring them within the LabKey Sample Manager and establishing how they relate to one another, which include like determining entity relationships, parent-child relationship across between those entities, mapping data flow between them. And once the data model is ready, we then design the Catalyst kitting workflow, which include 4 main steps: selecting a samples and entering details, then assigning the kit to a sample, assigning a provider to the kit, assigning a participant to a kit. And I would like to acknowledge here the LabKey service team, especially Steve Hansen. They have been quite helpful throughout this project. And Steve is our go-to person basically for anything that is related to LabKey. Configuration, he helped with configuration, he helped with the APIs, API related questions, and he has also helped us with setting up some quick demo projects as a proof of concept, and later on, which is tailored to our requirements, and it helps making it easier to explore and implement new functionalities. So thanks to Steve for all that help. So this is a screenshot of like steps that where we link kit to sample and sample to participants. The participant, all these data entities are quite customizable. So you can choose which field you want to search on, which fields to display in those drop downs. So as you can see here, like the drop downs are searchable and have bunch of information about the entity. And this one is our favorite. It shows the sample lineage plot. This shows the full chain of custody, who the samples belongs to, where the kit is coming from, uh, and associated providers, participant. And on the right hand side, you can see like all the detailed information about the sample, along with the direct links to other entities. And having these clickable links makes navigation easier and fast and intuitive. So we ship one or more batches of kits to participants or the providers every week. So for each batch, our colleagues from medical affairs run an instance of the workflow. And once the workflow is complete, an automated script runs every 15 minutes using LabKey APIs and performs some quality checks. So those quality checks include verifying that each sample is correctly linked to the kit, they are correctly linked to participant, provider, and if any of those links are missing, an alert is triggered. So ensuring by doing this quality checks, we are ensuring like all the samples are marked as used in the sample table, and if the script and if the user didn't fail to mark those samples as used, then script automatically mark them as used. It also flags any kind of like using duplicate samples. And in the end, I will have a couple slides for that shows our future directions and how we plan to use LabKey in future. So we have moved from professional version to an enterprise version, which will enable HIPAA compliance, and that will help us flag PHI, PII data, and give us give us option to control access, role-based access restrictions, and granular visibility control, and also have like access to full audit log. So far we have been using LabKey mostly for the operational data, but with the enterprise version, we plan to extend managing some of the clinical data, survey results, and genomic information, mostly transform data. And LabKey compliance feature will let us scale securely while it for this project. So while the LabKey is not a clinical genomic platform by itself, but it's quite useful for handling transform data, managing demographics, summaries, and also integrating some external sources, data from external sources, and performing some light analysis and exploration. So we plan to use LabKey for filtering, querying data, to build custom cohorts, and to generate cohort summaries. So it's not although it's not a bioinformatics tool, but it's a quite powerful companion for clinical research operations. Finally, I acknowledge all the Catalyst team members, especially Matt Lawler, who has been lead developer on and who helped develop most of these workflows. And also thanks to all our vendors and collaborators, especially Steve from LabKey, who has helped quite a lot on all these developing all these workflows. So thank you.
Thanks, Mustafa. While people are sort of submitting questions, I wanted to ask about how, in the theme of the conference, I think around sort of how adoption of these new tools went with the team, and if you have any lessons learned to share with folks.
I have worked on a bunch of LabKey systems. I have been working in the field of bioinformatics for about two decades so far. I have worked on a bunch of LabKeys, bunch of LIMS systems, and I suggested some of the improvements that might be possible on the sample manager, especially when it comes to workflow manager. If users get to like plug in their custom code to do quality checks, that is going to be quite helpful. But we like some of those other features that that I have highlighted, including that lineage plot, ability to customize what users can see on the workflow when they connect those different entities like a provider, participants, entity, kits, and samples. So those are some good features, but we are looking forward for like some more help from LabKey on ability to plug in our own custom code and do quality checks on the workflows.
Absolutely, and certainly have heard that and really are excited to start working on our workflow automation and hopefully be able to come up with a solution for you.
Thanks.
Another question is kind of around how the process was of connecting all of these various systems. Again, maybe any lessons learned there, or how did that go for you?
It's LabKey APIs are quite powerful, and it helps us to integrate all data from all these systems and seamlessly pass data to all other vendors, automate the process easily using those APIs. So we are using kind of like an integration hub, LabKey as an integration hub in this process.
Awesome. Okay, if there's any other questions, feel free to kind of include them in the chat and we'll follow up if we have time or after the presentation today.